I do a specialty called Mohs micrographic surgery. What Mohs is that we remove a cancer by taking about a millimeter of tissue, layer by layer, and analyzing that layer each time we remove it. If I remove the first layer and I analyze it and the cancer is removed, I stop the procedure and I repair you. If I analyze the first layer and there's cancer remaining, then I go back to that specific area and remove the cancer. I don't have to take an entire layer around the entire surface. I just go right back to that area and pinpoint where I need to remove. The most rewarding thing about what I do is that you really do affect the patient's life. When you're removing a cancer from a patient, doing the reconstruction, giving them a fantastic result, and have them come back a month later, it's really satisfying. There's not a day I go home where I don't feel like I actually contributed to someone's life. I've done micrographic surgery for over 20 years. I've done over 35,000 cases. And when you have that kind of expertise, you're really giving a patient an experience that probably can't be matched by most people. Mohs surgery is probably the most cost-effective way to treat a malignancy that we know of. It has a cure rate of 97 to 99%, very low recurrence rate, and done well in an office setting, it has never proved to be inferior than doing the procedure in a hospital setting.
We have a dermatopathology lab on site, and I serve as the dermatopathologist. So I'm board certified in that subspecialty. A dermatopathologist interprets skin biopsies. So if you were to go to a dermatologist, one of the providers in our practice, and they felt the need to take a skin biopsy because of concern for a skin lesion that may be cancerous or a skin rash, and so I interpret that, and I'm able to render a diagnosis through microscopic examination of the skin. Not all practices have dermatopathology labs. However, at Gwinnett Dermatology, we provide a unique service to our patients because we're able to do that on site in our facility, and so that helps to, as I said, render a more accurate and a more efficient diagnosis.